Good day, fellow learners. Once again, this is your mentor, your fact check buddy, Ray Gapuz, joining you for another session on PECHA KUCHA. This time, this specific PECHA KUCHA will cover concepts related to cardiovascular conditions and some drugs that we need to remember related to the cardiovascular system. So, before anything else, let me begin by sharing with you what a PECHA KUCHA is. So it's actually a format of storytelling that utilizes 20 slides, with each slide being commented on for a maximum of 20 seconds. The method usually lasts for 6 minutes and 40 seconds. How about that? You're able to recall very relevant questions for your test in just a matter of just under 7 minutes, 6 minutes and 40 seconds to be exact. Okay, so before we get to start, I'd like to ask you to join us in this mission. Our goal is to provide free NCLEX RN application and review to 100 nurses. We've done that last year. I hope we'll be able to achieve it again this year. So to help us achieve this, just watch and finish the ads in our videos. And thank you for doing that in advance. Here we go. Okay, let's begin with atrial fibrillation. Patients with this condition are usually the ones who are most at risk for stroke. So one of the priorities should be to administer anticoagulant. So the patient also needs to undergo MRI because most clots that causes stroke, that would cause stroke, are cardiac in origin. Next, second-degree heart block. Sometimes this condition could be related to digoxin toxicity. The main manifestation would be bradycardia. So therefore, we have to administer atropine or epinephrine to increase the heart rate. And you have to avoid, take note, verapamil and digoxin, as it may worsen the bradycardia. Next, torsado point is related to hypomagnesemia. The priority treatment will therefore involve IV administration of magnesium sulfate. This could potentially progress to ventricular fibrillation, so it's a priority condition to be taken care of by the nurse. Next, you have hypokalemia. There are several ECG changes like flat and inverted P wave, prolonged QT interval, your visible U wave, and of course, your mild ST depression. This could be associated with polyuria secondary to diabetes insipidus or diabetes mellitus, as well as the use of diuretics. It's very important to also note hyperkalemia. Now, ECG changes would involve tall peak T wave, loss of P wave, and widened QRS complex. Now, this could be associated with the use of potassium-sparing diuretics like your spironolactone or aldactone. So, never further increase the potassium. Okay, next, you have your asystole. Now, this is associated with a cardiac arrest, so you need to check the pulse. Management would usually involve the administration of epinephrine as soon as possible, and of course, CPR, intubation, and the administration of IV fluid. So it's important for the nurse to keep the patient monitored. Ventricular fibrillation is the most dangerous arrhythmia. Now, the priority would usually be doing CPR. It should be the first response. Remember, the ratio 30:2. Then administration of epinephrine and amiodarone, as well as defibrillation. So this is the most dangerous arrhythmia. Next, MI, you have several ECG changes like SC segment elevation, SC segment depression, T wave inversion, and of course, the irreversible pathologic Q wave. So priority would be administration of blood thinners like aspirin, then thrombolytics, oxygen, and nitroglycerin. Remember to begin with aspirin and thrombolytics. Next, digoxin. For patients taking digoxin, this could cause bradycardia, so instruct the patient to avoid taking the medication with black licorice. This could potentially lead to irregular heartbeat. Now, remember licorice is an herbal remedy with anti-diabetic properties, and it helps promote digestion. Next, propranolol is a beta blocker that may be used to reduce the signs and symptoms of anxiety, okay, secondary to anxiety disorders as well as hyperthyroidism. So the extended release is best taken at bedtime, but it may be taken with or without food. Next, quinidine can cause torsado point. So the use of this drug has been found to be fatal. That's why some countries it was already removed in the market. So it's not used in patients suffering from myasthenia gravis. It can potentially lead to blindness. So the levels must be monitored carefully. Next, dabigatran is a blood thinner. It's an anticoagulant. So it's the anticoagulant of choice for patients with atrial fibrillation. Common side effect would be GI irritation or heartburn, and of course, bleeding. So it's very important for the nurse to note those things. Next, you have verapamil. This is a calcium channel blocker. The common adverse effects are hypotension and bradycardia. So it's not given in conditions in which you have bradycardia, like heart block, in which there is bradycardia. It is usually used in patients with angina and atrial fibrillation. Atropine is a vagolytic, so it interferes with the functions of the vagus nerve. So it is not used in patients needing CPR because it has no benefit, and it may potentially worsen atrial fibrillation. However, it is used in complete heart block to increase the heart rate. Common side effect would be facial flushing. Amiodarone is an antiarrhythmic used in the treatment of conditions in which there is fast heart rate, like in ventricular arrhythmia. So common side effects would be nausea, anorexia, vomiting, and constipation. So the nurse should note the side effects. Next, we have sotalol, which is a beta blocker. It's used in the treatment of atrial fibrillation. Now, the common side effect would be swelling of the face, the arms, and then the legs, specifically the fingers. So another common side effect is your orthostatic hypotension. So you need to monitor the blood pressure of the patient taking sotalol. Next, isosorbide mononitrate. It relaxes the blood vessels, and at the same time, it increases the oxygen in the heart muscle. So it's used for the treatment of chest pain in angina. So instruct the patient to avoid taking drugs for erectile dysfunction like sildenafil, tadalafil, vardenafil, as well as ricoguat. Okay, and that's a vasodilator. Next, for nitroglycerin, it's also used in the treatment of patients with angina pectoris or chest pain. Once again, do not take it with tadalafil or sildenafil. Now, the overdose could actually lead to slow breathing and rapid heart rate or slow heart rate. Next, morphine is used in end-stage heart failure to reduce pain as well as anxiety. And it's also used in the treatment of chest pain in patients with MI. It's not given in patients with bronchial asthma as it may potentially depress respiration. Then aspirin, it's not given in asthma or in rhinitis or in patients with nasal polyps because this could potentially trigger bronchospasm. And it may potentially interact with your anticoagulants. It may potentially worsen bleeding. And so you need to question it if your patient is having hemorrhagic stroke. Okay, and that ends our PECHA KUCHA. And wow, those pictures are lovely. That's me about 60 pounds ago. Okay, anyway, let's learn together. If you have any request for any concept or topic which you may want me to cover in my future PECHA KUCHA videos, please do send me your request to my email, mentor.raygapuz@gmail.com. I'd be glad to create a learning tool for you. So, this is your mentor, your fact check buddy Ray Gapuz, saying a functional concept a day keeps your NCLEX RN fears away. Join me and see you in the next video. So if you love this video, please don't forget to subscribe, share, and hit the like and bell buttons. And remember our goal to help 100 nurses this year to turn their great American dreams to reality. Once again, this is your mentor who would love to propel you to where in the world you want to become a nurse. That's your goal. That's your dream. Let's work on it. This is your mentor, Ray Gapuz, saying, see you in our next video.